Have you ever wondered about these dots and strings moving before your eyes? They're debris in your eye doctors say. They're your own structured light of consciousness, we say. Want to know who's right? Stay tuned. I'm inspired by a seer named Nestor, who taught me to concentrate on bright dots and strings that are moving in my field of vision. To him, these are the first appearances of a subtle structure formed by our consciousness. Seeing this shining structure is a way to reconnect to our inner light of consciousness. When I started seeing these dots and strings myself, I did a lot of research. I discovered that the shining dots and strings are not only known but widespread. In ophthalmology, they are known as eye floaters, or mouches volantes, French for flying flies, which is a cloudiness of the vitreous humor. So, are floaters vitreous opacities, or are they the structured light of consciousness? We'd say that some floaters are vitreous opacities, but others are your inner consciousness light. It all depends on how exactly they look like. That's where it gets tricky. In fact, in ophthalmology, eye floaters is a collective term for different types of vitreous opacities that are attributed to different causes. For example, look at these types of floaters. The image is taken from an online survey conducted in 2025 and is based on patient reports and literature. The shining structure floaters we're researching and meditating on correspond best to the translucent dots and strands. The strands are actually transparent or bright little tubes filled with dots, and the dots are concentric circles with a bright or a dark core. Of course, ophthalmologists consider all of these types of floaters to be vitreous opacities. So according to ophthalmology, what causes these translucent floaters? This isn't entirely clear. There are three common answers. First, floaters are caused by cellular remnants, especially of the hyaloid artery that has regressed before birth. Second, they are caused by collagen fibrils that build the vitreous matrix, but clump together due to the age-related shrinking of the vitreous body. And third, they appear as a result of microscopic liquid pockets that form as a result of local liquefaction of the vitreous gel. We, on the other hand, argue that this translucent or shining structure type of floaters is mistaken for vitreous opacities, and that it is actually a phenomenon of consciousness. How did we get to this conclusion? We are not physicists, physiologists, or ophthalmologists, but we have been observing and researching our shining structure floaters for decades, and what we see can hardly be reconciled with the explanation of vitreous opacities. To support this argument, we will take a closer look in this series at how we see the shining structure floaters and ask some inconvenient questions for ophthalmology. The question for the next episode will be, if floaters are particles floating in the vitreous body, why do we keep seeing the same dots and strings? And what do you think? Do you think your floaters are just debris in UI, or could there be something more to it? Let me know in the comments.